My name is Dr. Cozy. It's really nice to meet you. And I see we have you here today because you've had a bit of an accident. Your hand? Okay. Is there anywhere else that was injured? You're not sure? Okay. Can you verify for me your name and date of birth? Perfect. Do you know where you are? Okay. And do you know what day it is? Good. So, okay. Can you tell me what happened? Oof. Okay. Wow. Okay. And you're not aware of any other injuries? Okay. Are you experiencing any kind of dizziness, confusion? How about any loss of consciousness? Any blurred vision? Ringing in your ears? Any nausea or vomiting? And do you know the date of your last tetanus shot? Okay, so you're up to date. Do you have any known medication allergies or any allergies to food or materials? Iodine? Okay. What is the reaction? All right, we will be sure to avoid that. And is this medication list up to date? Okay, good. All right. Okay. This down for now. Okay, so if I can just get you to focus right here on my finger, okay? Try to keep your eyes open. Good. Good. And then without turning your head at all, I just want you to follow my light just using your eyes. Okay, good. Now I'm just going to take a look at your eyes, okay? Hold my penlight to the side here. I put it away, I just would like to take a look inside of your mouth, okay? Excuse me. That was a weird kind of like half swallow. So if I can just have you open for me. Perfect, okay. Just need to check your airway. Okay. I'm going to remove my tongue depressor. Keep your mouth open for me. And lift up your tongue for me, please. Great. Okay, you can relax. Going to be palpating around your head a little bit and on your throat, just making sure that we completely rule out the possibility of any kind of other head injuries or any head injuries at all, really. Let me know if anywhere is painful. Feeling your shoulders and down your arms. Okay, not finding anything concerning. So now I'm going to take a look inside of your ears. Just looking for any kind of injuries or inflammation. Any changes consistent with an injury, which I'm not seeing anything. So check. Okay. Your ears are nice and clear, so that's good. Not seeing any kind of perforation or inflammation or any evidence of fluid collection. So that rules that out. Just going to take a quick peek inside of your nose. And other nostril. is I'm just going to take a listen to your chest, and then we're going to start dealing with your arm, or, sorry, your hand, arm. Okay. With the position of the bandage, I figured it could be both. Can I get you to take a deep breath in for me, please? And out. Good. And again, deep breath in. And out. Again. And one more deep breath in. And out. Good. Okay. My breath sounds are normal, nice and clear, so that's good. Not hearing any kind of wheezing or rhonchi or anything that would be concerning. So all right. So let's go ahead and get started. With addressing your hand. And I think we can fold that shucks pad in half. So I have a tray right here, and actually what I might do is use one more chucks to prop up your wrist. Up like so, and then let me move my stooling back. Oh, that's good. All right, so give me just a second. Okay, so if you're ready, I'm going to go ahead and remove this bandage, okay? Okay. All right. So looking at this, this is definitely going to need some sutures. So what I'm going to do really quickly is use a disinfecting numbing agent, okay? So it should not sting at all. Okay, we'll give that a second. And while we're waiting, I'm going to draw up some lidocaine. Which will help get you completely numb. Okay, so put that there for a sec. Okay. Are you able to feel this? Okay. Here. There. Here. 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 How about here, here, here? Here, here, here. Okay. Just need to make sure. So you might feel a little bit of pressure and you might feel a little bit of burning, but you should not feel much for very long. Okay. Doing great. Write down our lot number. don't know if that bind's going to help us too much right now, but keep it nearby. So, okay, I'm going to be using just some nice normal saline. It's warmed up a little bit to sort of irrigate and flush out anything that might be in there. So I've got this ready so that way if it dribbles I can catch it. Just like that. Oh, I don't see anything. Just gonna take a look at the tweezer here. Yeah, not see anything. So that's good. So I'm going to go ahead and disinfect with some betadine. Get that out of here. And just really quickly, I'm just going to measure. Okay. All right. If at any point you start to feel this, let me know. You shouldn't, but everybody reacts to different medications differently. So, a little bit of pressure. All right, first one's done. Give that one more time around just because it's interesting thread. All right. Right. You're doing great. I know it's hard to keep still for a really long time. So, do you have any plans for this weekend? Other than taking it easy, yeah. Okay. Honestly, having no plans is sometimes the best plan, in my opinion. Whoop. Especially because it seems like there's a lot of things to... Sorry, the thread got stuck. There's a lot of things to give us anxiety these days. And I think that wherever we can give ourselves some grace and take a break and do self-care of any kind is really important. I think that for a lot of things, we might not feel like it affects us in the moment. Things have a way of catching up to us. Our bodies hold on to stress, even if we're not, like, actively, cognitively experiencing it. It's interesting. Have you been watching anything good? I'm always interested in learning about new series to watch, because I feel like we go through these periods where it seems like we've watched everything, but like there's so much out there. Oop. Not bagel, did I get you? No, you're good. There's so much out there, but it's also like impossible to keep up because there's so many streaming services and it gets really expensive. Like, it'd be really nice if they could consolidate some of these. I mean, they kind of do. Like, there was a package for like Hulu, Disney Plus, ESPN. But it still wasn't like affordable. Life just keeps getting more expensive. Okay, so I think we can call it good with 1, 2, 3, 4, 5 sutures here. So let me just put my needle in the sharps. Oh, come on, stinker. This thread is a jerk. There we go. It did not want to go in. And we'll take these and put them into the autoclave bin. And I'm going to put some medication over this. It has an antibiotic in it, but it's also going to keep it nice and clean. So it has neomycin, and the petroleum jelly is also going to help and protect. We will send you home with a sample tube of this, so you don't need to buy one, but we'll want you to use it a bit sparingly. I'll tell you why in a second. Alright, I'm going to give you your hand back and then have you sit back. Okay. So how does your hand feel? Okay, good. So I just want to do a quick repeat check, okay? So stare right here, right between my eyebrows. And again, without turning your head at all, follow my light. Good. All right. Just want to make sure that you stay stable since you weren't aware if you had bumped your head. So, because of that, we will also be keeping you here for a little bit under observation, just so that way, in case your status changes, you start feeling faint, nauseated, anything just feels not quite right, we'll be able to address that right away for you. So as I was saying, in terms of sutures, you want to find a particular balance. You don't want to let them dry out, but you also don't want to keep them too moist, because if the skin becomes macerated, it can become difficult to close properly. So for that ointment, we'll have you use it once in the morning. And then unless you feel like the cut is starting to dry out, and you'll be able to tell by just feeling it, it'll feel kind of like it's pulling, once a day should be sufficient. Very important that you keep the hand dry and protected. A lot of people, if they need to take a shower, they'll put like a bag, like a grocery bag, one of the plastic ones, not the paper, and kind of like cinch it with a hair tie around the wrist to keep it protected. As much as you can do to avoid using that hand, it'll help it heal. We don't want to have you pull a stitch, or worse. body takes some time to heal, especially from a cut like that. So go easy on yourself and be gentle. Some pinky redness around the site is normal. Angry red, not normal. A little bit of clear drainage is okay. If you start seeing an excessive amount, like a lot, you keep having to change your bandage, or that drainage stops being clear, like it's opaque, I want you to come back in immediately, okay? And a little bit of bleeding is to be expected. A lot of bleeding, come back in and let us just check you. So same as if you start seeing like an increased amount of swelling from what it is right now, or after a few days that swelling does not start to go down. Okay. Also, if you develop a fever, you start getting nauseated, throwing up, or you just start just really not feeling good, again, come back in so we can check you and make sure that everything's okay. Okay. When the nurse comes in to give you your discharge paperwork, she will have sheets that she's going to go over with you to make sure that you understand all of the warning signs, and it also comes with very specific instructions so you'll know exactly what to do. Okay, so just give me a moment. I'm just going to chart a couple of things. All right. So how's your pain level right now? Any new symptoms? Any new pain or anything? Okay, so you're still feeling pretty numb. Okay. That should last for a few more hours, but I will be having one of our nurses come in with some pain medication as well as a prescription for you to take to your pharmacy, okay? And that should help. No, it's just an anti-inflammatory, so it shouldn't make you feel any kind of way. You should just feel pretty normal. But it is recommended to take it with food. Okay? If you don't, you can feel a little bit of an upset stomach. It might make you feel a bit nauseated, so it's definitely best to take it with food. We will be keeping you here for another hour, okay? And I'll have some nurses coming in periodically to check on you and make sure that you're okay. If for any reason you start not feeling okay, there is a call button right here on the remote control, which also controls the TV if you'd like to watch anything. Okay. Do you have any questions for me before I step out? Okay. Well, I will see you back here in a couple of weeks when you come in to have those sutures removed. Okay. You take care.